Okay, thank you all for joining. I think we should get started. We have a lot on our plate today with a very exciting agenda. So with that, welcome to the January 30th Common Fund Data Ecosystem Public Webinar Series. I'm going to be starting us off today with some updates, and then we'll go into our featured speakers. So first up, I just want to remind everyone that all of our webinars are recorded and available on our YouTube. Please feel free to scan the QR code here to access these videos. And if you have any questions, please reach out to me. I can also send any links as needed. Just a reminder, if you have any general feedback, questions, you'd like to be added to our listserv, please email us at help@cfdeknowledge.org. And just giving everyone a look into the events that we'll be having for our webinar series schedule. These are the confirmed speakers for the rest of our lineup. We do have some openings for July and November. So if your program is interested, please feel free to contact me. We're very excited to this incredible lineup. So we look forward to seeing you at these future webinars as well. And to give some information on some upcoming conferences for the first half of the year, the first one will be the U.S. Association for the Study of Pain, where A2CPS and Spark will be in Philadelphia in March. So please, if you're attending, take a look for their booth and ancillary session. The second is the American Physiology Summit in April, Minneapolis, and Spark will be there as well. And we'll have the Bio IT World Conference and Expo in Boston in May, and that will be the CFDE Training Center, and we'll be there for the Knowledge Center as well. For the Bio IT Data Hackathon, which will be hosted by the Training Center. So this is going to be one of the key events that will be at this conference. This is the seventh year that they're hosting the BioIT Fair Data Hackathon, and this will be on May 18th and 19th. Please note that this is before the conference, so just if you're planning on attending, that is just a shift in the dates. And so this has a focus on open source tools and adhering to fair data principles. Another event that is upcoming that the Training Center will also be hosting is an Omics Open House. And this will be February 19th from 1 to 2 p.m. Eastern. Please register via Zoom and bring your genomics related questions. Another thing that we have is the Decoding the Data Ecosystem, a Training Center podcast. This is for anyone who is passionate about, omics research and specifically how that can help solve complex biological puzzles and addressing health challenges. There are 13 episodes that are available now, and you can listen to this podcast wherever you prefer. One event that I would like to highlight that is upcoming in July is the Common Fund Data Ecosystem Incubator for Pan NIH Resources. This is essentially a forum for NIH partners to identify shared goals, gaps, and collaborative opportunities. We are hoping that this is a way for us to exchange ideas across both NIH and CFDE, specifically to, help with standards and increase uniformity and reproducibility across initiatives. And this is going to be held at the Neuroscience Center at the NIH in July, as I had mentioned. We will have more details regarding this session in terms of the agenda and hotel bookings and things like that as we go forward. But right now, we are gauging interest to see who would like to attend a session, whether you would like to be a presenter or a speaker for a poster. So if you are interested, please feel free to let me know as we will be organizing this event. I will also share an interest form for everyone as well who is going to be on this call. And I'll just pause for a moment there if anyone has any questions for any of the upcoming events before we hand it over to the Biomarker KB. Okay. It looks like we don't have any questions for that, so I'll hand it off to Raja and Jeet.
All right. Thank you very much, Mackenzie. Thank you for organizing this. And I'll jump right in. And we'll take questions. I think questions are throughout the session, as you mentioned.
Great.
And then we can answer them at the end. So I'm going to talk about biomarker knowledge base today. And it's a unified knowledge base for biomarker exploration. And at the bottom here, already I have put down all of the URLs. So there are different ways to access biomarker, and I'll talk about this throughout this seminar, where I'll talk about BiomarkerKB.org, and Jeet is later going to do a small demo on all of these resources that we have built. So my talk is around 30 minutes, and then 15 minutes live demo by Jeet, and then 10 minutes for Q&A. So what is a biomarker? We all know what it is, and we have some idea, but defining a biomarker, actually, a really nice definition, the FDA NIH Biomarker Working Group, they have a really nice definition where they define a biomarker as characteristic that is measured as an indicator of normal biological process, as pathogenic processes, or response to an exposure or intervention, including therapeutic interventions. And this is very important, and this is called the best biomarker definition. And when you think about it, there are different types of biomarkers, and how you define them matters, because when you're trying to extract biomarker data from any source, from a publication or from electronic health records or from anywhere else, if you do not have the right categories, then this can lead to confusion. And the major categories, there are 7 categories: diagnostic, monitoring, predictive, risk, safety, and response. And at different times of the disease progression, these biomarkers become important. In the early stages, we can think about risk biomarkers and diagnostic, and I'll talk about the definitions in a minute. And then predictive biomarkers when the disease is in the middle of the disease, and then there are monitoring biomarkers, and prognostic, safety, and response biomarkers come at later stages of the disease progression. So I'm going to spend a little bit of time on this slide because it's quite important. And when we read papers on biomarkers, we are not really thinking about this. And also definitely when authors publish papers, they don't clearly say which of these biomarkers they are talking about. So risk biomarkers or susceptibility biomarkers are biomarkers that show a person's chances of getting certain diseases before any symptoms appear. All right. So before the symptoms are there, can you tell if that disease is going to happen or not? Diagnostic are to help to detect or confirm if you have a specific disease or condition. So there are some symptoms already, and you have a diagnostic biomarker to see if the person has the disease or not. Prognostic is help predict how the disease is likely to progress or recur, regardless of the treatment received. So it's not connected to the treatment yet for prognostic. And then predictive is biomarkers which will help experience a favorable or unfavorable response to a medical product. So if a person gets some intervention or a medical product, then will the person respond or not respond? Monitoring is when you're measuring repeatedly to track the disease status, right? The person has the disease, we know that, and then you're tracking it. Response biomarkers is it going to be beneficial or harmful? Has any biological response has happened when the person was exposed to a medical product? Safety biomarkers are indicating if there is a toxicity. So is there an adverse event? So these are the 7 major categories at the very high level of how the FDA NIH group defines the biomarker. So in biomarker knowledge base, we go beyond that. We keep this as the main umbrella, and then we move forward. And the reason for why we are doing this, because we want to diagnose and classify. It will help biomarkers can aid in accurate disease diagnosis, classification of disease subtypes, and more. It can predict the risk. And of course, you want to monitor the disease because you want to know what kind of medical intervention is needed or not needed. And then if there's a treatment, you want to know what the response is. And of course, all of this, a lot of this is driven by industry and FDA, and definitely a large part of biomedical research focuses on biomarker research and development. And impact on healthcare it is enormous. Biomarkers helps in early detection, better outcomes, personalized treatments, cost efficiency, and many, many more. But at a very high level, you can think of many reasons why biomarkers are really, really important, and why a biomarker-centric view of molecular data can be interesting. And that's the key. So for decades, and gene-centric view, protein-centric view has been very popular and has helped figure out a lot of things. And then people said, okay, let's look at it at the pathway-centric view, or lipid or glycan-centric view. But we are kind of rephrasing this whole thing. Can we look at all of the data that the biomedical science produces with a biomarker view, and what does it do? So that is the guiding principle. And then, I picked a paper here. There are many papers like this, how people are talking about biomarkers in the paper. So on the left here, there's a schema of minimal liver disease. So there are lipids and keratin 18, and the bottom here, these keratin 18 gets cleaved off in early alcohol-associated liver disease, and K18 with a particular type of assay, M65 assay, is used as a biomarker to see if you have a lot of it, then it is early ALD versus minimal liver disease or healthy subjects. So this is used as a biomarker. So the paper talks about it really nicely, and one can say, okay, so I want to make a biomarker entry out of this. What does it mean? From the paper, how do you make an entry? So now it's just pure bioinformatics, right? We need fields and values. So, we say increased level of KRT18 is the biomarker. The condition is alcohol-associated liver disease. The condition ID is a certain disease ontology ID. What is the assessed biomarker entity? Okay, we say it's keratin 18, M65. Assessed entity type, keratin 18 is a protein. Assessed biomarker entity ID is this protein has ID in UniProt. So here you see we are trying to connect everything again from a biomarker-centric view. And then by reading the paper, we realize, okay, it can be definitely a diagnostic biomarker, maybe even a prognostic in certain cases. Specimen is serum, specimen ID we get from Uberon, and then we have the evidence from the paper itself, and the paper is the evidence. So this is how we approach the entire development of the biomarker, but we are not only looking at papers, and I will talk about other ways we are doing things. And as I was going through the earlier example, you must have thought, well, also what about, and there are many, many questions, and I will not be able to go through all of them, but these are all interesting, very interesting questions. So I said, well, let's look at COVID-19 or interleukin-6. There are papers which talk about interleukin-6 at a certain level can be a biomarker for COVID-19. But we already know that interleukin-6 is upregulated and is present in other type of scenarios. So one can also ask the question in terms of comorbidity. So the person who has cancer and COVID-19, will their interleukin-6 be different ranges compared to people who just have COVID-19? What about age? What about sex? So these are all interesting things that we can address if we standardize and think about the biomarker in a certain way and have a very robust data model. By robust, I don't mean that it won't change ever. By robust, I mean that is it extensible without having to redo the underlying underpinning of the data model. So in this particular example, in the same way as the previous one, I'm not going to go through all of that. We can map all of the fields into our data model. And what it does is, and while we were doing that, what we found out was that information about biomarkers There are lots of places, papers, drug labels, electronic health records, FDA PDF files. It's there. Clinical trials, but it's fragmented. It's almost always free text, and sometimes key information can be missing, and it has to be inferred or imputed. And there's a vast amount of data diversity. So a biomarker, so you can ask the question, what about image biomarkers? What about gait biomarkers? Gait is when a person let's say, has a stroke and their gait changes, right? So you can think about it in many, many, many different ways, and which challenges data scientists to, or people like me, a bioinformatician, to think, how do you then model this type of data over time? So we do believe that it is possible to have a unified biomarker framework to organize data for structure and accessibility. So that if you systematically organize all of this information, irrespective of what the biomolecule is, it could be a glycan, it could be a lipid, it could be a metabolite, it could be literally anything, protein, part of a protein, peptide, amino acid, so a lot, what is being measured you can then connect it to higher level entities, standardized formats and schemas that can be used, and you can provide easy access and retrieval. It's a huge task. I'm not going to say no, it's not, but it is possible. So then you can link, and this all started with also thinking about annotations that you can associate these biomarkers or connect these biomarkers to. So Common Fund Data Ecosystem has huge amount of information and knowledge, right, about the biomolecular entities. We have genes, we have proteins, we have lipids, glycans, metabolites, and so on. So then if we can connect these, and we have information about expression of the genes. And so if we can connect all of this information together, the CFDE has, then it will be great. And we can then add even more content from external databases. And this will enhance our knowledge of the biomarkers. So what it can do, it can identify hidden connections, discover new relationships, and enable breakthrough research. So a little bit of history. We started thinking about biomarkers quite some time back. So this is OncoMix. OncoMix was a NCI funded project that we had with Jet Propulsion, JPL, NASA JPL, us, and BG from Switzerland. And when we were working on that, we realized the need for this, and we were thinking about cancer biomarkers per se. Then COVID-19 hit us, right? And COVID-19 actually, in terms of, if you think about biomarkers, was a unique event, especially at this time. So if you look at biomarkers of diseases that has been around and people know about for a long time, like diabetes or cancer or whatever have you, there are lots of papers that were published in different years, right? So people write papers, people read papers, do experiments, and do more experiments and write more papers of the biomarkers. But COVID-19 was really unique. What we found out that biomarkers of COVID-19, people were publishing that this is a possible biomarker. This is something that one can use to figure out if a person is going to survive or not survive, or it requires ICU. So we would see in real time, weekly basis, if not daily, and we were curating them manually at that time. LLM was still not that much of a thing at that time, right? So everybody was at home. There were people, PhD students, faculty, people from all over actually, was working on a project that we were doing online, and we curated our first set. And then we realized, as post-COVID-19 biomarkers, how important it is to connect all the different types, not just molecular. So for example, opacity of the lung is a biomarker in COVID-19. It is a biomarker other places too. So we'd go and try to find out, is that biomarker mentioned anywhere else? And we would say, okay, it's not there yet. So we have to come up with a new HPO term or new term in some other resource. So that allowed us to create the crux of the biomarker data set. And then through the biomarker partnership that we started in 2023, we were able to expand it to a variety of data types. And then now we are in this current stage where we have the biomarker knowledge base, which has data from all of these different steps that we had. So The goals of the biomarker knowledge base is to unify biomarker knowledge, integrate clinical and molecular data, support knowledge graph and AI ML driven biomarker discovery, accelerate translation and precision medicine research, and allow new biomarker exploration, bridge preclinical and clinical gaps, enhance biomarker data usability for clinician research and researchers. And this is one of the main slides. So this is our view, bird's eye view of what is a biomarker. So if you want to say, okay, I have biomarkers, then we will say, okay, do you have information on what we have in the green boxes? So you need to tell me, or tell us the biomarker, what is the alteration, what is the amount, what is the entity here? And then once you give it to us, we would also need to figure out what is the assessed biomarker entity. Is it a gene? Is it a protein? Is it a peptide? And then we give it an ID. And then we also need to know what is the condition. So a biomarker cannot stay on its own. It is connected to a condition or exposure agent, right? So we will have to fill these boxes in to create a biomarker. Once you have these green boxes, I'm just showing just a small number of blue boxes here. We can do a lot, not just we, others can do it too. So everything we have is up on our website, so people can also connect things that we have not thought about connecting to. So you can connect to line codes. We can have specimen ID. We can have the assessed entity type. Is it a gene? Is it a protein? Best biomarker role, evidence source. Is it coming from a paper? Is it coming from ClinVar? What is the evidence? So we also collect free text, which can help us later on in text mining or LLM-based approaches. So we are collecting data. From the right side, you see some of the common fund DCCs. They are giving us data. And on the left side, we are also collaborating or getting data. Sometimes we have to collaborate if their downloads are not easy to understand for our purposes, what we are trying to do. And this is, again, a small list. We have many more on the left side also. And when we do this, you can do knowledge graphs, you can have APIs, and of course, we have a front end, which people can explore. Even though our biomarker knowledge base is not about developing a biomarker ontology, but we do realize the importance of having a biomarker ontology. And we started working or thinking about biomarker ontology. We published this in 2021 in International Conference for Biomedical Ontologies. So at this point, what we are trying to do is that we are working with, it's a group. If anybody wants to join our ontology working group, we meet once a month. It's a little bit early in the morning, 8 a.m. Once a month. I think it's on a Tuesday. Let me know, send me an email and we will add you to it. So this is a group of people who are not part of the biomarker knowledge base partnership, but they are interested in biomarker ontology. And we are trying to develop an ontology, and then we try to then make sure that our data model matches the ontology or guides the ontology. So our job is to provide real examples so that the ontology that is being developed uses real example, is not completely philosophical. So that's at least how I see it. So we also realize that the ontology cannot really do everything that we need to do immediately. So in biomarker knowledge base, we have controlled vocabulary. This is on our wiki. We have text, text page, actually there are different formats. Here we are showing a text format on our wiki. It has at different levels what type of entity types we have, and how can you take the entire biomarker field and break it down into these controlled vocabulary so that we can parse through hundreds of thousands of biomarkers and see if there is any problem in any of the biomarker names. So you can do some really interesting QA/QC on the field. It's not comprehensive. Our biomarker, our entity type and other are controlled vocabulary. We only add terms only if we have an example in BiomarkerKB. Otherwise, it will blow up, right? So if I have an example of a biomarker, if no controlled vocabulary exists for that, then we will add it to our CV file. This is the front end. I'm not going to spend time because Jeet is going to do a demo on the front end. So biomarkerkb.org is the link. Brief statistics. What do we have? We have over 200,000 unique biomarkers. We have biomarker disease associations, over 200,000. We have over 100 multi-component biomarkers. Conditions are over 800. And the risk, as you can see, not all of them, we don't have a good coverage over all different biomarker categories, but that's something we hope to increase our coverage over time. It all depends on where most of the research lies in, and which ones are the ones we have focused at this current stage. On the right side are which resources contribute to majority of our biomarkers. ClinVar is one of the highest. GWAS is next. Oncomix, OpenTarget, and Civic and others. We know they have certain numbers, and they all bring in value to it, right? Because these different resources provide different types of biomarkers, which allows us to make our data model stronger. And in terms of looking at these biomarkers through knowledge graph, we have been working very closely with Deanne Taylor's group on DDKG, Data Distillery Knowledge Graph. And this visualization of the knowledge graph also comes from Avi Mayan's group, where we provide the triples to their group, and you can only see, there is an interface. The interface link is at the bottom, where you can search for, in this case, thyroid cancer, and see all of the connections to thyroid cancer. So this is in addition to the interface earlier link that I showed, where you can do simple searches, Boolean searches, other types of searches to identify and see the biomarkers. We have semantic URLs. So if you see, we have biomarkerkb.org, and now we have data.biomarkerkb.org, where you can download the data. We have api.biomarkerkb.org, where there's API access. So you can easily integrate or pull data from BiomarkerKB into your own resource and display it if you want to. And we have, again, wiki.biomarker. It's an internal wiki using MediaWiki. So all our documentation, FAQ, help documentation, everything ends up in the wiki, so that this allows us to do rapid updates. So for example, I can be on the metro and I'm looking at the FAQs, I don't understand what that's going on. I can change it literally there. I don't have to wait. I don't have to involve anybody, and I can make updates. So the wiki has been really, really useful in helping us update the documentation, which happens regularly with every release. So we do believe that the data that we want could be of use for many people. We use a permissive license, CC by 4.0, which means you can use the data any way you want. You need to cite us. That's what we hope you can do. It can be used for commercial purposes or academics. It doesn't matter. All our source code is also on GitHub, and which also means you can put up your own site using the data if you want to. So I want to talk, it's a lot of work, and I'm from George Washington, Jeet and I, and we are not working alone. So we are working, I mentioned a few names earlier already. We are working with a group of partners, and they are doing some unique contributions, which I want to highlight. So this is the metabolite biomarker group. So what they have been doing is really interesting. So LOINC so when you go to the clinic and the doctor writes, okay, this is the test you need to do. So one of the arguments that we have is that if it is a test that is prescribed in the clinic, a test is most probably, I would say, is talking about a biomarker, right? So a test will find something which will allow the doctor to do something. Fine. So tests use these codes. So there's a code, you go to Quest, and they will say, okay, this is the test you need to do. So which means that if we take a look at these tests, maybe we can identify biomarkers from them. Um, it's easy to say that. So that, Shankar and I, we were talking. I said, okay, Shankar, do you think this is possible? And we said, but then his group, Srini and others, what it turns out that those tests, the biomarker information that I showed in the data model is all in free text. So sometimes it's not even there, but it's free text. So one has to map, and manually, if you're going to do it, it'll take us years. Luckily, they came up with a really nice, I won't have time to go through this entire thing, but a really nice methodology that uses the logging data. And they looked at right now they're looking at metabolites. So first they have to identify within the logging which are the metabolites, because they have a lot of experience there. So they look at the classes chem, and then from there they parse the text files from logging, and then eventually they use AI, LLM, and last step is, they have metabolite biomarkers. And they have been really successful in collecting these biomarkers. And then what they do is that they go back to publications to get more information about those biomarkers. So it's a really nice workflow to identify biomarkers. The fact that this workflow had to be developed literally from scratch is because this type of information, the clinical space and the public biomedical database space, they're not connected. We all know that very well. So this is a great example of how that connection can happen. So EDRN, Early Detection Research Network, it's a decades-long project, an NCI project. Hundreds of researchers are part of it. They have biomarkers, cancer biomarkers they have been working on for many, many years. So they are part of the project, and they are doing a slightly different, because their data is more structured than Loin. So they're using a certain slightly different large language model, but still free text, where they are pulling out biomarkers from their biomarker report. So their biomarker report is just textual. A lot of it is text, and this text, standardized text there, but nonetheless, it needs to be done to make sure that we have all the main fields in the biomarker. And that's Caltech and JPL, Jet Propulsion Lab group, Dan Crichton and Ashish. University of New Mexico, IDG group, they are doing something very interesting. So they are taking biomarkers and then first trying to figure out, can I find patients who have no disease in their health record? Patients with no disease that they can identify at least. Then you pull it out. Now you must be thinking, oh, just because there is nothing there doesn't mean that they're not sick. And you're absolutely right. So they take the middle 80% of those patients, the values, based on the values of troponin I in this case, and then give it to us. We then present this data with 1.5 IQR, so 1.5 interquartile range. So what we try to do is that, by no way I'm saying what we have is they are all healthy, but the only thing I'm saying is that when we can't find that they are unhealthy, this is the range. And then we go back and see in publications, troponin I, what ranges are expected in healthy population. So we are kind of blindly looking at data, which is really good, without all the baggage of what is known by the community in the publications. But then we come back there and put it side by side to see what is going on. So now, if it doesn't match what is expected, the median. So here we are mostly looking at the median, right? Even though we have box plots I'll show. The idea is that the median gives us a very good idea, let's say age group, 20 to 30, what should be the troponin levels? 80 to 90, what should be the level? So yes, I can Google or ChatGPT troponin I, but there are certain biomarkers you cannot just Google and ChatGPT and get the results. It is not data-driven result. It is information that is already in publications, right? Or other published reports. So we feel that this is a great reality check, and it will give our users, in BiomarkerKB users, a nice idea. And of course, many of these tests, especially assays, one has to dig much, much, much deeper, because the company that makes the assay, the way the assay is done, all of them have variabilities, right? I'm not saying we are solving any of that right now, but this is the step one, mapping, and then pulling something out, and then more work would need to be done to show all of those. So yeah, on our website, you can see a figure like this. So it's troponin I. Yes, it's nanogram per mil. Usually it is reported in nanogram per liter, but we need to standardize across multiple type of assays and biomarkers. We are still trying to figure out what is the best way to show these things. And you see how the median goes up with age and sex and female, male, it is different. So we feel this is a nice way to look at the biomarkers on a web page in addition to knowing something is a biomarker. I'll end. I just one more slide, or a couple of more slides. So, unlike other databases, which is just entry based, when I say entry based means, like UniProt or RefSeq or GenBank, the classical resources, you go to a protein entry, you go to a gene entry. So yes, you can go to the biomarker entry and look at one entry, but I don't think that is going to be our top use case for BiomarkerKB. I feel that the biomarkers have more value and interesting use cases when they are connected to other pieces of knowledge through, in this case, knowledge graphs. So we are working with the Proto-OKN knowledge graph group, which is the NSF NIH collaboration we are part of. And they have a lot of diverse data sets. So they have a framework for connecting and sharing knowledge across diverse domains, interoperability. They have also, I won't say developing technology per se, but they are also standardizing what technologies are best for these type of large scale, huge graphs. And they are thinking about facilitating AI and machine learning applications, principle of openness, accessibility, and standardization. Again, democratize access to knowledge infrastructure. And Biomarker, we are submitting our graph to them, and it will get automatically connected to other entities as long as our entity matches any other entity that already exists in there. And they have healthcare data, agriculture data. I had a great conversation with somebody from USDA. They have biomarkers, but they are not clinical biomarkers. But it's interesting that same biomarker can be a clinical in some context and agricultural in some context. So those things are interesting connections. Material science, supply chain, education. We have uploaded version 1 of the paper on bioRxiv. Most likely, I will be updating that with another version soon. If you want to read more about it and see where we are currently, you can take a look. The URL is at the bottom. Again, I want to acknowledge on the right side is the partnership, which was a 1-year partnership, which helps us tremendously. And then on the left side is our current partners, and we are working closely to get this all to the community. And my last slide is an important slide also, because as you're listening, if you have questions, please send us a message. We usually respond within a couple of days, business days. So we love to hear from you and improve the resource, or maybe you have biomarkers, we want to add them. If you are on LinkedIn, you can follow us. If you are on Blue Sky, we also do post on Blue Sky. And that's it from my side. Jeet, all yours.
All right, thank you, Raja, for beautifully introducing what BiomarkerKB is.
Did you guys, sorry, Raj and Jeet, just 1 second. Raja, that was excellent. I learned more about biomarkers in this 10 minutes, 15 minutes than I ever have. This is awesome. Did you guys there was a question in the chat. Did you guys address that about what
Yeah,
models you're
sorry.
taking?
I was holding off until the end for them, but we can address those now if we'd like. Um,
Yeah,
so
I think it's worth it just before it gets too far away. You want to read out the
Okay.
question? Yeah.
okay,
Let me see.
I can read them if you want, Raja.
Okay, please. Yeah.
Yeah, no worries. The first is I'm still at a loss to know if having my COVID-19 means I have circulating antibodies. I've had 3 vax and finally got the disease. This was an anonymous.
I'm not the best person to answer that one.
Okay, no worries. And
I
then
wonder,
oh, go ahead.
I think it was one that might be the most relevant to where ours is the one about the capture context dependent information about cell line specific participants. That one, Mackenzie, I think that one might be good to answer out loud to everyone.
Sure.
Yeah.
The question asks, do you capture context-dependent information, such as the research is based on a specific cell line, participants of a specific demographic criteria? If so, how do you model it in your KG?
Yeah. So we do collect information about cell line, tissue, and all of these other things, but we do not collect right now. So I'll talk about this collection problem, demographics. Let's think about demographics for a second. I cannot get demographics data from Loing. So there was one of our sources, right? I cannot get demographic data always from all of the resources I'm talking about. But demographic data is either two places I can think of, maybe there are others, is there in a publication. So the publication will say what the demographic was, where the biomarker was. So we do plan in the future to use large language models to pull that type of information and so show side by side. The other piece of demographic data that I'm really excited about, we'll see how far we get there, is from electronic health records. So if you have biomarker, all that talk I said about test is a biomarker, test aka biomarker, I can pull out, demographics, race, age, sex, you name it, whatever we can pull out. And if you have hundreds and thousands or millions of patient data that I can pull out of, I am quite confident we will get the normal distribution to quite a decent level. That right now we are thinking normal, right? We can also say people with cancer. What is it? So to me, sky is the limit. And because we put our biomarker out to everybody, anybody can download our biomarker list and do exactly what I'm saying. If you have access to Epic, you can, or Cosmos, right? If you have access to Cosmos, you can write a simple query and look at it right now for any biomarker of your interest. I can't provide, or we can't provide Cosmos data. Cosmos is the Epic, the entire millions of patient data for those of you. So it opens up downstream analysis that we haven't even thought about.
Yeah, and at this moment, I would like to add, we do capture like tissue-specific information and connect it to Ubron, but at this moment, we don't have data to very specific cell line. But in future, yeah, we might add to our biomarkers.
Great.
Okay.
Thank you. I think we can leave the other questions until the end. So.
Okay, all right. So with this, I'm going to share my screen and hopefully the demo works. Hi, everyone. My name is Jeet Vora, and I'm the project manager for BiomarkerKB project. So I'm going to walk you through the portal or the front end that we have built, which is the BiomarkerKB, and you can access at biomarkerkb.org. Let me also add to it is this portal is, we did it, or we pushed it to the front end a little over 6 months. So it is quite a new portal. We are rapidly doing releases with new features and new data. So yeah, we are not still there where we want to, but it's in process to get matured and look like one of the beautiful and comprehensive portal. Uh, but we do have essential biomarker data that you can really explore it really well and get the information that you need for your research. So this is the home page that you land upon through the URL that was shown in the slide, and you can also see it here. And on this homepage, we just have at the moment 3 cards: the biomarker search, which allow you to look into the search options. You can go to the data portal, clicking on this data card, and you can access the APIs for the API. So the intent of building or modeling our data was not only a researcher can come and access the data, but we also want our data to be interoperable, other databases they can connect with our data. The knowledge graphs can use our data, and you can have if you have a programming experience, you can just pull all of our data and information using the API. So that's pretty much what we wanted when we were designing the portal. So on the top, you can see that we proudly showcase this button, connect to the CFDE, so you can get the information about CFDE through that button. If you scroll a little bit below, you get the version and statistics, and we have other entire site menu options also listed at the bottom. Now, if one comes to this portal and would like to search for a biomarker, how they can do it? Of course, they can go into the biomarker search and explore, but they can also type it what we call in the global search, the global search box. So you can type using your gene name or your metabolite, or it could be any chemical element. So most researchers, they come with their own gene name and they put in the search box to see what biomarkers are there for the given gene or a protein. So if I do IL-6, which is the interleukin-6 protein, and if you search, you'll get a result and it will show you IL-6 biomarkers. And I'll come to this page and talk a little bit in brief about this list page, but let's go back a minute and look at other things that we have. So this is the Explore. We have the biomarker ontology, where Radha showed how this data model and the ontology are in sync, and whatever is also any biomarkers that are not present in BiomarkerKB are also captured through this ontology. So it's a very comprehensive ontology for biomarker data. So one can explore. In the future, we would like to add more examples and make it more interactive, but this is a quick way to look at the ontology. Then we have the knowledge graph. Once you click on it, it comes to a page. This was developed by Avi Mayan's group. And if you look at the example, what you see is what are the biomarkers for thyroid cancer? And you can see these are the biomarkers under or in various genes. And these are all connected by the OPSI, which is the ontology ID 00008, which is denotes for the risk biomarker. So you can explore the data using the knowledge graph. You can start with DOID, you can start with the other options which are present over here. You can start with the protein ID and gene ID, so on and so forth. And you can play around with other options to fine tune or look into the data that you're really interested in. So that's the biomarker KG. Then we have the help, which have the FAQ, the contact us, where you can use the contact us to submit your data, or if you have any questions, or if you want to have like a demo for your group, you can talk to us or reach out to us using the contact us option. The about, we have our mission. If you click on it, you'll come to know what BiomarkerKB is about, who all are part of the team, so on and so forth. Basic stuff for a knowledge base or a database. Then I was talking, or Raja was talking about the wiki page. So this is a wiki page. It's still, we have to add many things in here, but this is where you can find the documentation about the project. One of them is data submission upload. If you want to submit a data, you have a few instructions and few things where you need to or you need to format your data in certain way and give it to us in a certain format. You can also talk to us and we can guide you with that. So that's the wiki page. And of course, we have this special submit option as well. If you want, if you know the data model, you can just use this to submit biomarker data, and we'll connect with you and see if that needs to be formatted, or if you have more stuff, we can take a look at it and get it integrated into the portal. Then I would like to go to the data portal. So this is the portal. Let me zoom this a little bit. So this is what you see is our data portal where you have all the data sets that we have integrated the data from. On the left-hand side, we have the filters where you can filter through certain categories. So click on it. Uh, you can see the sample view, which has the sample rows. It also gives you the information about the version, how many records were there, so on and so forth. So these fields that you see are based on the biomarker data model. You also have a BCO JSON, which captures the metadata in the form of a biocompute object metadata schema. So that's the um, machine readable metadata or README. We also have a human readable data where you have, what's the name of the data set, how it was processed and generated, so on and so forth. And then you have the download link where you can download either the biocompute object, the BCO, or you can download the data set. So that's what we have. On the top menu, we have release history. You can go back to portal or API if wherever you want to go from the top menu. So that was the home page as well as the menu options. Now let's look into the ways you can search biomarker data. So if you go on to the biomarker search, you'll have three different entry points. Simple search, as you can see, is a very simplistic form of search where if you know the biomarker ID, you can enter it here. Or if you know the condition that you want to work, condition in this is the disease. So for example, colorectal cancer, you can also enter that here. You can select this example, and when you search on it, you'll come to the list page. The second entry option is the advanced search. As the name says, it's more advanced. It allows you to fine tune your search, and that fine tuning can be based on either of this category, what you see. It could be specimen, which is usually your tissue or a bodily fluid. You can mention it over here, and it will kind of search. And of course, you can, if you want to try it out, you can always click on this example and it will get inserted into this search box. You can also search through line codes. So these are like logical observation identifiers, names and codes. So these are assigned to any lab tests that are performed by a clinician. So you can also search by these line codes. Then you have the assessed entity types. This is where if you want to get all the biomarkers for gene, you can select the gene option, or you can go to protein and it will give you all the gene or protein biomarkers. The entity is if you want to do a specific one. So on and so forth. So there are multiple ways where you can narrow down your search using the advanced search. If you just press the search biomarker button without putting anything, that's also still fine. It will give you all of the biomarkers that are there in the knowledge base. So that's completely fine if you just click search biomarker. And then we also have implemented AI query assistant. It's still in beta stage. But here you can put your query into an English natural language query, and it will try to find out the biomarkers. So in the example, what we are showing here is, can you show me protein biomarkers related to prostate cancer? And if you click on it and press search, it's going to search the protein markers, biomarkers, which are associated with prostate cancer. So if you see, these are the protein names. This is the actual biomarker, which suggests, the change in the entity type, the ID, and at the right, extreme right, you see these are all under prostate cancer. So this is one of the way you can search. And if you didn't get the answer that you were looking for, you can always contact us, and we're still trying and testing it, and we'll make sure we get your feedback, and based on your feedback, we improve this search. So that's the AI search. Now let's go to the advanced search and show you. So I'm clicking here on protein. And let's take a look at all the protein biomarkers. Okay, so we land up on this page. So we call this page as a list page. So this is where you get some information, not all of the information, but it's an at a glance information for all the protein biomarkers that are present in the knowledge base. On the left-hand side, you have a bunch of filters where you can use it and filter it. So you can do it by biomarker role, which could be monitoring, predictive, response, prognostic. And when you click on it, the results, they change. So now we have 97 results. If you uncheck, you are again back to 602 results. You can also do protein complex, what are associated with it, and narrow your search again. You can download this entire list also by clicking on the download option. So if this is what you want to work with, good enough, you can download it, and it will get downloaded into a CSV format, or if you want a machine readable format, it will get downloaded in JSON format if you click the JSON option. We can also filter these rows. There's another concept is called as canonical IDs. And non-canonical ID, which is basically if you see this, or if I click on this particular ID, that is a canonical ID, but what you get is under the canonical IDs, there are different IDs where the entity name is the same, but the condition is different. So for that canonical ID AN6278, which talks about interleukin 6, but these specific IDs are for the same entity name but different condition IDs. Now, in order to go to the details page, you have to click this link which says view details. And if you click on it, you get to the BiomarkerKB details page. And on the left hand side, you see the menu options that we currently have. And if you click on each of any of the menu option, you can come to that respective section. So in this case, you get in the general information about the ID, what is the canonical ID, the actual biomarker ID. And this is the important section which we have named as biomarker components. This is where you get most of the biomarker information. So you have the source. So what's the PMID or publication source for this particular data? So this is listed here. If it comes from a specific resource and it's also associated with PMIDs, it's listed under source. Biomarker standardized. So this is the standardized version of the biomarker. Raja was talking to you about control vocabulary. So this is defined based on the control vocabulary. This is how the biomarker is reported originally from the resource or how it was extracted. We have the assessed biomarker entity. The type is protein. The entity ID is UniProt with its identifier, and these are the line codes. These line codes are same for these specimens because they are belonging to the same category, which is blood, plasma, serum, and they are identified or standardized using Oberon IDs. And at the bottom section, you have the condition. So this particular biomarker is found in COVID-19. And we have description, synonyms, and as per best biomarker role, this is both a prognostic as well as predictive biomarker. And if you scroll a little bit down, we have the entity normal ranges. So this is the EHR data that Raja was talking about. Now, this specific data information comes from GWDC. So this is the box plot that we show. It's also available in the data format. We'll add a download button here, and you'll be able to download that. And then we have the evidence where the statements from the publications are extracted and shown over here. And it's always accompanied by the PMID, so you can look into it. Then we have cross references for the proteins. Right now we have added 4, but we are in the pipeline to add as many as we can, but we don't want to blow up this section entirely. So we're thinking of a mechanism where we can show it properly. So if you click on it, you land up to the respective resource page. And at the bottom, you have information of all the publications that are found on this page. So that's our portal. I know it's 2 p.m. We're almost crossed our hour. So if you have any questions, if you have data, you can talk to us. You can also, use this feedback option and write to us if you see a problem, if you have a question or a suggestion. And usually a ticket gets created and we'll contact you and get to work. If it's your question or your suggestion or anything else. So with this, I'm going to stop and pass it on to you, Mackenzie. And thank you for listening to us.
Thank you so much.
Just one quick thing, a shout out to
Yeah.
University of Georgia UGA team, Renee, Renzinger, and Sujit for the portals that Jeet showed.
Great. Noelle, you had your hand up.
Oh, no, I meant to, I was actually trying to clap. I want to say thank you. That was really excellent.
Eve, I see you have your hand up. Let me take you off mute for 1 second. Sorry. Let me just find this.
So I thank you very much. Very, very clinically relevant. I mean, I don't get too deep into this right now, but yeah, very relevant. Thank you so much. What a great webinar.
Thank you.
Great. Thanks, Eve. Thank you again to our speakers. We really appreciate you joining us today. As a reminder, this will be available on YouTube. So if you have colleagues or coworkers that weren't able to attend, please feel free to share this with them. Our next webinar is going to be February 27th from 1 to 2 p.m. And we will have Elizabeth Chun from SMOT. So we hope to see you all there. Big thank you again for joining us, Raja and Jeet. We really appreciate it.
Thanks, everyone. Bye-bye.
Thank you. Bye.